Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. All over the world, there were almost 84 million confirmed cases of COVID-19, more than 47 million recoveries, and over 1.8 million deaths on January the 1st, 2021. In Nigeria, on the same day, records show more than 88,000 cases, over 74,000 recoveries, and 1,294 deaths. Recovery rate is 83.95% and fatality rate is about 1.46%. When most energies in the health sector were being expended on COVID-19, other diseases suffered neglect. Yet, rather than let up, Nigeria is facing a second wave of COVID-19. This comes with implications. My guest on the show today, joining us from our Abuja studio, is Dr. Safiya Ojo, a family physician. You're welcome to the show, Dr. Ojo. I know that one of the problems that we had with this COVID-19 was a lot of missed vaccinations. And who knows, maybe some people were even having their children at home. What could be the implication or complications of missed vaccinations?
Thank you very much for the question. COVID-19, we know, is an ongoing pandemic that's affected more than 200 countries all over the world. It is ongoing, and presently we are experiencing the second wave of COVID-19. And we know that the symptoms of COVID-19 include cough, difficulty in breathing, chest pain. Some could have loss of taste or loss of smell. So these are some of the signs and symptoms of COVID-19. And we know that chronic illnesses have been there for a long time. It's not new, even prior to COVID-19 era. And a lot is needed when you're talking about chronic illnesses. Then talking about missed vaccination, especially maybe in kids. Yes, a lot of patients, a lot of women were pregnant during this COVID era from the first lockdown. We had refused to register for antenatal care due to fear of contracting COVID-19 within the hospital facilities. So some of them had to present in the hospital for the first time at 6 months of gestation, in which if there are complications that need to be arrested ab initio, those ones might have been missed. So a lot has happened because of COVID-19, because a lot of resources, everything was channeled towards the treatment and management of COVID-19 and the complications, thereby neglecting chronic diseases, which has a lot of negative impact too. We know chronic illnesses include, we have diabetes, hypertension, heart disease, cardiovascular disease, which is disease of the heart and the blood vessels, stroke, arthritis. These chronic diseases meant to be managed adequately in healthcare facilities, we know.
We'll come to chronic illnesses.
To follow up during the COVID pandemic, it has really resulted into loss of lives, even at home. So vaccinations, talking about vaccinations are very important. We have childhood vaccinations in which a lot of children, all of them, in fact, not all children must be vaccinated so that they will have immunity against childhood illnesses. A lot of them were not vaccinated because of fear of contracting COVID-19 via the hospitals or healthcare facilities.
Some people have suggested, some doctors have suggested that even though some children missed vaccinations, that it's okay to bring them at the earliest opportunity after to still take those vaccinations. For example, we'll come to chronic illnesses in a moment, but let's talk about the infectious ones. Maybe somebody was due for yellow fever vaccine, let's say, and didn't get it. And then we had this 9 months of, restriction and all that stuff, or maybe six months of being away. Is it okay for the person to now get the vaccination, or could it cause any complications?
No, the person can still go for the vaccination. There's nothing wrong about that. So missing a vaccination doesn't mean you can't get vaccinated. You should still go back to the health care facility and get vaccinated. Because when children are not vaccinated, we know what could happen. All these avoidable ailments could come up, and they could have severe forms that could lead to childhood death. So I think they should go to the hospitals to get their vaccines that they missed as a result of the lockdown during COVID or fear of going to the hospitals. So I think it's better that way.
What if the lockdown happened?
For prevention.
What if the lockdown happened when a child was, maybe 4 weeks, 6 weeks old? He's supposed to take DPT, and then there's, this lockdown happened and it was for several months. Is it still valid to take DPT at the end of lockdown?
Yes, it's still valid. What we'll do in the hospital mainly is to now is timing. From when you're seeing the patient in the hospital, you start the vaccination and you try to start giving the regular intervals that you're supposed to give.
Okay.
So there's nothing wrong if the child still goes back to get the vaccination, because the vaccination is very important in under 6, which means children less than 6 years of age. They need to all be vaccinated.
Okay. We
all know childhood illnesses were not. Okay.
We all know how yellow fever seemed to, take the country by surprise. In fact, it was funny to me that they were mentioning a strange disease, only to find out that it's yellow fever, and I'm like, is yellow fever strange? So lots of people died anyway. Do you think that it would have been detected faster with less consequences if COVID was not on at the time?
Yes, you're quite right. The effect of COVID on both childhood infections and even on other illnesses cannot be overemphasized, because of the COVID, a lot of people, they don't want to take their kids for vaccination, and at the end of the day, they come down with these childhood preventable illnesses, which wouldn't have even come into place if they were vaccinated ab initio. So I think what we should do now, yes, we should emphasize more. We need parents to have adequate knowledge on the importance of vaccination. They need to go to the hospital to get their child vaccinated, either with COVID or no COVID. They should just make sure they ensure distancing, physical distancing. Then they should use their face masks while trying to get to the facility. Those cases will have been prevented, because I'm sure those ones that came down with yellow fever, most of them, if you check well, they might not have had the vaccines, because when a child is vaccinated against an illness, even when the child comes down with that same illness, it will be a very milder form of the illness, which may even not be detected, as it may even come undiagnosed because the effect is not seen on the child. So the effect of vaccination cannot be overemphasized. I know a COVID-19 has caused a lot of disruption when you're talking about healthcare in total, talking about from even the pregnancy, delivery, vaccination of children, and even management of the critical chronic illnesses that are prevalent all over the world.
Let's talk about some of those chronic illnesses. In the past few weeks, to my dismay, I've been hearing about quite a few people who have died from heart attack. I thought that, the initial consultations with a doctor, for somebody who has heart problems are enough, and the person can go home and, with doctor's instructions, continue to manage himself. But people died. Why is that?
Thank you for the question. A lot of people actually died during this COVID from heart attack. The reasons are not far-fetched. For example, let's talk about diabetes mellitus. Diabetes mellitus is a chronic medical condition. Hypertension is a chronic medical condition. We have also obstructive airway diseases. There are a lot of diseases that are chronic, that need adequate management and a prolonged follow-up visit. So talking about death from heart attack, it depends on the severity of the illness. When a doctor makes a diagnosis, prior to diagnosis, a history is taken. History taken, adequate examination, investigations to back up the diagnosis of the illness. And now we go to what we call a treatment plan or a care plan for the patient. A care plan of the patient means what do you want to do for this patient over months? Is this patient, even at the point of diagnosis, fit to go home? Do I need to admit this patient for 5 days to stabilize this patient? Is this patient is it an emergency? So we need to, all this has to be put into consideration when talking about management of chronic illness. But there are some that were actually lost to follow up during the COVID pandemic. Some were not doing well with their medications at home, and they were left for some months. They didn't go to the hospital because of fear of contracting COVID. And at the end of the day, for example, patients with diabetes, they could have cardiac arrest. It affects the vessels of the heart. People with hypertension, their blood pressure could go so high that they develop hypertensive emergencies. And at the end of the day, they could have cardiac arrest. So these things, the reason are not far-fetched. A lot of people were lost to follow up. They weren't going for their appointments in the hospitals. For a doctor, when you check a patient, you've made your diagnosis and everything is certain, oh, this patient is suffering from this illness. From the care plan, you're able to know the patient that's supposed to be admitted right away for stability prior to discharge. And sometimes the kind of follow-up visit we give depends on the severity of that patient. If you want a patient that is a very critical condition, after you make a diagnosis of a chronic illness, you need to tell the patient that you need, as a patient, to be involved in the management of your own disease. For example, talking about diabetes or hypertension, the patient has to be totally involved, the family members has to be involved, and even the healthcare practitioner. So it has to be a holistic approach. It has to be an integrated type of care when you're talking about management of chronic illness. Those that die at home, a lot of them, maybe they couldn't even go on with their medications. They don't go for their they didn't go for the follow-up one because of fear of COVID. But some of them, where they don't even have the medications at home again. And I know what doctors do most times is that we try to, most of my patients have my phone number. They call me and say, oh, doctor, I noticed my blood pressure today is 130/80. What should I do? Should I continue at that present medication, or I should reduce the dosage? There is no doctor that will not listen to a patient for effective management, because we are involved in management of these diseases, both the patient, the doctors, and even the family members. And another thing is about education of a patient. You need to educate the patient about the illness. When a patient is well educated about the illness and the complications, she knows what to do when some symptoms or new symptoms arises.
Okay, let me
so all this has
quickly
to be put into consideration.
Let me quickly come in there. Now, obviously, some patients were not educated enough, and that is why some of these things happened. Now, are you concerned with the way this second wave is going? You know, having more numbers, looking more severe than the first wave. Are you concerned, you know, for people with such diseases at this time? Could it be that we'll have more lost people because of the second wave? And is there something we can do to make that not happen?
Yes, due to the second wave, it's obvious that a lot of patients will be lost more to follow up, because they don't want to go to the hospital to start with. And at the end of the day, they keep managing their chronic illness at home. And if not adequately managed, it could lead to loss of life. So there is a fear of having more loss of lives as a result of COVID, this second wave we are having. Because talking about chronic illness, we know chronic illness such as diabetes, hypertension, stroke, heart diseases, and chronic obstructive airway diseases. These diseases, people with those underlying conditions may have severe forms of COVID-19, which we know. That's so correct. In such people, severity is more in them. And even when they are treating this illness and they are not well managed as a result of not taking their medications and as a result of not coming for follow-up visits, it will even result into a higher mortality rate. Nigeria now, I think there was a documentation that about 24% of mortality is from chronic illness, chronic diseases, also known as non-communicable diseases. And all over the world, it's a major concern. And because of the COVID, the adequate management of this chronic illness is taking a back seat. Talking about loss of follow-up, lack of integrated care when talking about the management and all that. So a lot of issues from a lot of negative impact we've seen, which is quite obvious from COVID-19 and its effects. So I think we need to sit down and think of a more comprehensive approach when talking about management of chronic illnesses. Try to see what is the way forward. How do we manage these patients? How do we prevent deaths at home as a result of fear of contracting COVID? So I know that for those that are very stable, we give a longer follow-up visit. So your visits to the hospital won't be so frequent to reduce risks of coming in contact with other patients with COVID or non-COVID. But I think what we should do is we should always, as a medical practitioner, we can actually try to see those patients that are high risk more. Those ones that you think you see them as an emergency, that has to be well followed up, that has to be well evaluated prior to discharge to homes. I'm not talking about
Dr. Ojo. Let me quickly cut in there. We will continue this after the break, and I really want to touch on mental illnesses. But let's take a short break, and we'll continue when we come back. Welcome back. We're talking about COVID-19 in relation to other diseases and even the second wave in relation to other diseases. This is Health Matters. You can call 0808-054-2233. It's showing on your screen now. And you can also tweet at CTV_Mary A with your questions while we continue with the program. Now, Dr. Safia Ojo, doctors are saying that the advent of COVID-19 made it a really bad year for mental health. Can you throw some more light on that? Because people are wondering, mental health really?
Thank you. Talking about mental health conditions, mental health of individuals, there are illnesses that could actually affect people's mental health. Like, for example, the COVID-19. It has a lot of effects on our mental health because this is a disease that people don't know when it will end. It has affected a lot of families, even the economic impact. So it has affected the educational sector. Every sector is being affected by COVID. So that would definitely affect the mental health of individuals in the nation. So the reason is not far-fetched because this is a disease that has caused a very devastating effect all over the world. Now we are having the second wave. So there are a lot of uncertainties on what will happen, how is it going to end, and with a country that even the healthcare sector was not in place, when you don't even have adequate facilities ab initio, when you're talking about management of healthcare conditions. So that will also affect a lot of the mental health of the citizens of the country. So I think it has acted. What we can do now is to try to see how best do we manage this pandemic, and how do we also channel our resources to other important health conditions, so that the effect on the citizens will reduce drastically, because we know the economic impact, the social, everything. It has a lot of impact.
Okay,
so
we're having a phone call
really
now.
Devastating.
Can we just quickly take Akirata from Okuku? Hello.
Hello.
A question. Welcome to the show.
Yes. Good afternoon, ma. Good afternoon, ma.
Good afternoon.
My question is, we who have been going to the hospital to attend the hospital and attend the clinic, but for a while now they did not agree to attend to us again. They said because of COVID-19 that we should go there, we call us. And they did not call us up to today. And when we go there, they continue postponing without knowing any cause.
Thank you. Let's attend to that. So, Dr. Ojo, yes, this is not the first time I'm hearing this complaint. People say they go to the hospital and they are turned back because of COVID-19. Apparently, the fear is on the side of the health workers this time. How do we solve this problem?
Yes, talking about being turned back from the hospital, I think is quite wrong, because it's not all patients presenting to the hospital that have COVID. Prior to COVID-19 pandemic, there are other illnesses that have been existing for years. We have chronic medical conditions. We have some infectious diseases that are treatable. So I don't think patients should be sent home because of fear of COVID. What the doctors should do is to make sure they are protected. Use your face masks. Try to avoid social distancing between you and your patient, and try to prioritize. There are patients that may even come in because of a diarrhea disease, or even maybe their blood pressure gets so high. So we shouldn't allow the death rate to increase because we are sending these patients home because of fear of contracting COVID. And most hospitals, I think they actually have, you should have a high index of suspicion when you're thinking about COVID. For example, a lot of, they do the check, they try to check temperatures even before entering to see a doctor. So there are some things we need to look out for, so that we won't be too, because of fear of COVID, a lot of people die from other mild diseases. So we think a lot has to be done when talking about management of other diseases during COVID era. So we shouldn't increase our mortality for fear of contracting COVID, either by a healthcare practitioner or even from the patient. So adequate care is needed at this point. There was a patient telling me, I think about at the onset of COVID some months ago, a patient was said to die at home, not because from COVID, he had a diabetes and the sugar went up at home. So these are things we should. And I think patients too should have their doctor's numbers. There are some patients that, if you have your doctor's number, you may not even need to come to the hospital. You can tell your doctor, these are the symptoms I have. There are a lot of patients I had to manage during the COVID without setting my eyes on them, but I had to save lives. So this, I think it has to do with priority. Those ones, I can't insist that they should leave their state to come to see me. I need to do an examination before I make a diagnosis. Because if you are a doctor and you'll be treating patients for years, if a patient starts telling about some symptoms at home, you should have a high index of what the patient is all about. Sometimes I have patients that tell me what I feel.
Some of these hospitals have a triage tent outside the hospital. Do you think every hospital should have that now, just so that they can separate, more infectious ones from others?
Yes, it's very important. It's paramount that all hospitals should do that if they really plan to provide effective care for patients. Because you can't let patients die of other mild illnesses because of COVID. Because you need to prioritize, you need to know who is coming with what. So I think that check should be mandatory. All hospitals should try and have a screening area prior to the patient entering to see the doctor. That will minimize loss of lives from other diseases, from fear of COVID. So I think when we're talking about illnesses generally, talking about chronic care management, like the one we're talking about chronic disease management, it has to be a supportive, integrated care between the patient, family members, and the healthcare practitioner. So I think for those that are stable, you can call your doctor. They can give a longer appointment. Instead of telling your patient to come every month, for very stable patient, you can give them up to 3 months appointment. But they communicate with you on phone. This is what I feel. This is my blood pressure this morning. Am I doing well and all that? So it will limit people coming in contact with the healthcare facility, which can be avoidable. But for talking about other illnesses, I think it won't be fair if patients die of other illnesses from fear of COVID. They should not be sent home for any reason. Every hospital should have a place where patients are being checked as they are coming into the hospital. They get their temperature checked. They can even ask for some few symptoms. While checking the temperature, do you have so symptoms? If you have high index of suspicion, you may actually tell the patient to wait somewhere, and further investigations can be run on that patient.
Thank you, doctor. Let me quickly ask you this last question. Now, COVID-19 protocols, washing of hands, social distancing, wearing masks, is supposed to keep us safer from COVID-19. Well and good, we know that. But it's supposed to also keep us safer from other infectious diseases. How do you think we have fared? Are we safer now or not?
We are not. Talking about safety, we are not safer now. Because I noticed that after the first wave, during the first wave of the virus, a lot of people were scared of contracting this virus. So they had to use their face masks, they used their hand sanitizers. Social distancing in a way was carried out. But after a while, after the lockdown was, people started their daily activities, now going to work, go to wherever you want to go to. A lot of people no longer use their face masks. I don't know if there is a way we can make it mandatory. Maybe the government should ensure that maybe a sanction is being put on whoever is found not using face masks. Because we can't be talking about second wave of the virus and we are very negligent. We are not doing the right thing, and you want
this is a good point to stop.
To reduce.
This is a fine point to stop. Thank you very much. You have really pushed out the message and nailed it on the head. We have to keep the safety protocols. Thank you so much for being on the show with me today. It was wonderful having you.
Thanks for having me.
And thank you also there at home for being on the show and calling in with your questions. Have a wonderful year, wonderful and safe. I'm Mary Alale Yusuf.